First, live, local. This is Fox 12 Now.
Welcome back to Fox 12 Now. I'm Greg Nibbler, and thanks for joining us. We're live here in the Fox 12 Oregon newsroom. And right now, we're going to talk about a new federal partnership with the state of Oregon for the Oregon Health Authority to help fund different medical initiatives and health initiatives in rural Oregon, something that's important for a number of reasons. We're going to talk about what some of those projects are and just how this all works. Joining us now from the Oregon Health Authority, we have the Director of Health Policy, Steph Jarem, with us. And Steph, thank you very much for joining us here to talk about this, and just how this is going to help out so many different people. But before we even get there, could you tell us about how this funding came about and what this funding is, to begin with?
This is funding that is out of the Rural Health Transformation Program. It's a new federal initiative that was created when U.S. House Resolution 1, which is the Trump administration's tax and spending bill, was signed into law last year in July 2025. And between 2026 and 2031, the program will provide up to $50 billion nationwide to improve healthcare in rural communities. Oregon applied for the funding and was able to receive a total of $197.3 million for the first year.
And receiving that funding now, what are some of the priorities or what are some of the initiatives that this funding is going to go toward?
We have a number of priorities. We are focused specifically on supporting our healthy communities and prevention. We're supporting expansions in healthcare workforce, supporting technology improvements across different rural communities in the state, supporting regional efforts to bring together partners to think about their needs in their communities. And we also have a tribal initiative.
So a number of different aspects there. What are some of the biggest concerns out there when it comes to medical health care for rural Oregonians?
It's a great question. Nationwide and in Oregon, rural communities are often experiencing many health conditions like cancer and heart disease and diabetes at higher rates than we see in cities. And that's tied with the fact that rural communities often have fewer healthcare resources available to them than the big cities. It means that many people in rural communities and remote communities have to travel longer distances or often go without care, which really exacerbates their issues.
And this funding and some of these initiatives, from what I understand, naturally would be helping to improve that access. Is that right?
Yes, our goal here is to really be able to support the needs of the communities and think about how a 5-year investment in these communities can really help us in the long run to support an improved and transformed rural health care network and system. We are anticipating pretty significant Medicaid cuts, and we know that those are going to hit rural communities harder. As their populations often have higher rates of Medicaid enrollment than cities. And this funding won't be able to offset the significance of those cuts.
So it's not just going to facilities and things like that. This is going to actually directly impact financially, I guess, or make up for some of that financial loss that could come from those things.
I think our challenge will be to see how we can use these funds to support and stabilize some of those organizations. They cannot use the funding to specifically offset the cuts, unfortunately. That's a directive from the federal government. And so we're seeing really exciting projects, really interesting efforts to think about how to expand mobile health care or consider how telehealth can help in communities. To really be creative with new ways to provide care in rural communities that meets patients where they are.
When it comes to that care, if we are able to get some more mobile units or more access, would this be something that people would apply through like the regular insurance to utilize, or would people on Medicaid have access to this? I guess financially, how would that work for those rural Oregonians?
Fortunately, we are partnering with a number of different organizations throughout the state, so it's not exclusive to only providing care for Medicaid or only providing care for uninsured people. It really should support everyone who is served in rural communities.
And when it comes to those projects, I know that we touched on them just for a minute, but for examples for people, I know we were showing some footage of like North Bend, and there I know Polk County is one of the other ones that's going to be receiving some of this funding. Could you tell us, just for people out there to get an idea of what it is that they can expect from, say, those two projects?
So the projects in general, we have 136 new projects that are receiving funding. It's supporting every community and county in the state. We are, as I mentioned, we have a number of mobile health clinics, really creative uses of being able to meet people where they're at, being able to focus on eye care or behavioral health supports in for homebound adults, those types of things. We are seeing great expansions and training programs to support rural healthcare, everything from K-12 in the actual elementary, middle, and high schools to support growth into the field of healthcare workforce, as well as training programs for those folks who are already in the field and want to expand or upskill. We're seeing really creative projects that are growing the healthcare workforce, that are expanding rural pharmacies, thinking about ways in which people can access a pharmacy. We know that there have been challenges in access there. Every one of our local public health authorities in the state, every one of our critical access hospitals and rural hospitals, and all of our rural health clinics are also receiving funding. So really trying to distribute funds across the state to the organizations themselves who know what the needs are, to hopefully see, improvements in the access to care, the number of hours opening later, being able to really creatively approach healthcare in rural communities in a way that we haven't always been able to.
And how long until this funding goes into effect, or that we'll start to see some of that funding be distributed and utilized?
So we saw some dollars going out the door as early as April of this year. For the latest round of funding, we are working really quickly with the organizations to confirm the grant agreements and hope for dollars to be spent out starting next month.
All right. Well, thank you very much. Anything else that you think is important for people to know about this?
We're just really happy to be working with everybody. There are so many great ideas. We couldn't even fund all the ideas that came in, and we're looking forward to another 4 years, hopefully, of this program.
All right. Thank you very much for joining us here on Fox 12 Now.
Thank you.
And for everyone watching, again, as we mentioned, this is Fox 12 Now. We're live streaming here out of the newsroom, and we'll be here throughout the afternoon until 4 p.m. So if there's breaking news that happens between now and then, we'll have that for you. But we've got a lot of other conversations and segments for you. We do have to take a quick break, so we're going to do that right back after that with more Fox 12 Now.